To start our session, D4, Closing the Gaps, How to Achieve a Robust Health System Throughout Southeast Asia, I would like to invite Dr. Tan Tiha, Strategy Program Quality and Resources Development Director in World Vision International in Vietnam. Everyone, please welcome Dr. Tan Tiha.
Yes, so good afternoon, everyone, and our distinguished guests and colleagues and friends. So welcome to this panel discussion on closing the gap, how to achieve a robust health system throughout East Asia, Southeast Asia. So as we all know that East Asians have taken very important step to strengthen regional health security. In 2023, the region adopted the Declaration on One Health Initiative and the established Asian One Health Network. This is a milestone toward the cross-sectorial collaboration and protect as well as to promote the health of our community in ASEAN. Yes, the challenges remain significant from the limited infrastructure and unequal access to healthcare services to the shortage of skilled health professionals, as well as the gap in pandemic preparedness. ASEAN countries are still navigating the complex reality. According to WHO, non-communicable diseases accounting more than half of deaths in our region, about 9.5 million people every year. Meanwhile, the disparity in universal health coverage highlights the uneven progress that continue to shape our collective health resilience. So today's session, we explore these pressing issues and focus on how ASEAN existing framework and solution can be implemented more effectively through the active engagement of government, the private sector, civil society, and the wider public. While we also learn from best practice across Southeast Asia, we hear diverse perspectives on how to build stronger, fairer, and more sustainable health system. So let's join me to welcome our 4 distinguished guests. So first, I would like to introduce Miss Andre Ong. A big hand to her, please. Yeah. So Mr. Andre Ong is our board leader, social innovator, author, and former nominated member of Parliament in Singapore, yes, for the period of 2018 to 2020. And with 35 years of cross-sector leadership in business, government, civil society, she brings a wide expertise in governance, organization, well-being, and inclusive growth. Welcome, Ms. Andre Ong. Thank you. Yeah. So let us also welcome another distinguished speaker, Professor Chandra. A big hand to him, please. Yeah. Professor Chandra Yoga Di Aditama. He is the director of postgraduate school of Yarasi University. So Professor Chandra, he is also is a lecturer and director of university in Yarasi, but also in adjunct at the Griffith University, Australia as well. So a big hand for Professor Chandra. Thank you. And another speaker, that Dr. Vũ Thị Hoàng Mỹ. Yeah, she's a senior strategic advisor, medical policy of Alio Consulting from Vietnam. Yeah. And Dr. Mỹ is known as Dr. Mimi as well. Yeah. And she have over 35 years of experience across the clinical care, global health, private sector leadership, and consulting. So let's welcome the last distinguished speaker is Dr. Phiu Phiu. Dr. Phiu Phiu is a Myanmar Australian fellow affiliated with both the University of Melbourne and the Australia National University. She's also a medical doctor and epidemiologist and lecturer at the University of Hong Kong. So let's give a big hand to all our distinguished guests today. Yeah. Thank you. So, now we would like to have some conversation with you on our distinguished panelists. And to start our conversation, so let us look at the most pressing health issue in our region. That is access to healthcare. So why our Asians have taken important steps to improve the accessibility for healthcare, but some countries we see that a lot of good progress, like Brunei, Malaysia, Singapore, and Thailand. They are almost achieved nearly 100 universal health coverage. This is a system recommended by WHO to ensure that all people can access to healthcare as they need. However, in some other countries in the region, they are still on the journey toward this goal. So this is an important question that what are the key obstacles standing in the way, and what are the strategies that can help us to move forward? So I'd like to invite first Dr. Phiu Phiu to address this question, and then also Dr. Mimi follow. Thank you. Over to you, please.
Thank you so much, our moderator, Dr. Tantiha, and all the distinguished guests and my co-panelists. So just to save the time, I would like to summarize obstacles into 6 and solutions into 3. So when it comes to 6 obstacles, I would like to present you hierarchically. So the first one I mentioned will be the most pressing issue, which is political will. So if your government doesn't have enough political will to give full access healthcare to your population, no matter what you do, your country will not have full access. For example, United States, yes, they spend a lot of money on health, but access to healthcare is quite actually questionable in the United States. In Singapore, the money spent on health is not as high as United States, but they have full access to healthcare. So political will, number one. And Myanmar, we have a civil war. There is a lot of politics and people are in trouble. So political will. The second is 3M, money, materials, like healthcare financing, help workforce, and also like drugs and other things like immunizations. So these are actual problem because some countries are very poor, we cannot afford it, and Southeast Asia never ever have enough workforce, and a lot of Southeast Asians medical doctors from Philippines, they migrated to well-to-do countries. It is also connected to the third obstacle, which is policy. So Philippines policy changed, they allow nurses to migrate. It is wiping out of their workforce. I'm not blaming that, but what I'm trying to say is everything's interconnected. And the fourth obstacle is digital gap. So we are actually striking so forward, but a lot of our ASEAN countries are left behind because majority of our people cannot access to internet or they don't have enough literacy towards technology, especially also AI, telehealth, telemedicine, etc. And also finally, we have practical gap, which is geographical gap. They are mountains area, they are rural area, they are urban area. That kind of things actually create low access to healthcare, and sometimes it is really hard for people to travel to a clinic if your mountain is too far away from a clinic. And the final obstacle is like something Myanmar is facing, like internet conflicts, civil wars. People are fighting, and pregnant women even cannot get to a delivery place. So there are so much like in Gaza, so that's also really important. So how do we overcome these obstacles? I have three summary. First, we have to actually talk about bottom-up approaches. So this conference, I came here importantly because I believe this is talking to CSOs, CBOs. That's way forward. We have to create policies from the ground, prioritization frameworks from the ground. Yes, sometimes top-down is important, but if your government is not good, you have no other way, have to start from the bottom. Another one is digital solution. So no matter how much we are poor, there are ways we can create technological driven solutions if you can get access to internet. So we should really feel that we are left behind. Yes, there is digital gap, but we can find ways to actually solve some solutions, some problems. And finally, regional collaboration. One country cannot solve a problem alone. For example, pandemic. For example, vaccine preventable diseases outbreak. If Myanmar get that kind of outbreak, it is regional impact. So you really need to open up what's happening in Myanmar, what's happening in Gaza, because it can become a global issue. So global and local collaboration is inevitable solution and must do it. We must do it. We must keep talking to each other, and we cannot live alone. So that's my kind of very quick response to your question.
Thank you so much for your insightful input from Dr. Phiu Phiu. And I'd like to turn on Dr. Huang Mi. You have any addition to this question? Please go ahead.
Good afternoon, everybody. Thank you for raising this topic. It's very important, critical. We're talking about coverage for universal healthcare coverage, 100% for every people where they need. But in our region for ASEAN, we say, okay, just some country look like Singapore, Malaysia, Thailand, they advanced, they nearly 100% already. So what the others still on the journey? And we say the commitment is there already, very strong. But implementation, the journey is very complex and uneven. So from point of view from me as the doctor, I'm come from Vietnam, so I can give some the key three main challenge that for this barrier for the others still struggling to reach this goal. The first is about the financing. The second is service delivery. And the last one, very important, is the workforce. The financing, you say, for the health insurance, every country, the social health insurance, the coverage is improved significantly. For example, in Vietnam, right now, they cover nearly 92% of the its population to have this coverage for what they need for basic. But still, compare to the reason is still low. But the other very important, that's out of the pocket burden is still very high. It's account nearly over 40% of total health expenditure. And that is created, it's not efficiency at the goal we want. So that's how the health insurance can expand and modernize to provide, to scout for the new treatment, the diagnostics for the people they need. That's the firstly about the financial under the health universal coverage funding. The second about we talk service delivery, as Dr. Phiu mentioned. The reason is a disparity between the rural or city is very big gaps, and the service on the community level, the health station in the community, where the first point of care for the people they live in the village, in the rural, wherever very far away from the big city. Even the system there, but they lack of essential for medicine, for diagnostic, and that's even the infrastructure is not available, so it's hard. And even they're looking for the digital tool or system mechanism to help them to refer the patient to the higher level of care. So that's create more the pressure on the central level in the hospital too. So on that disparity, that is a barrier for the service delivery. And the last one, okay, health professional, the workforce, very important. We still, most of the country, we still in the journey is struggling because of lack of skilled professional in the field, especially in the rural area. How can encourage them to stay there, to work, to retain, and with even you provide a primary healthcare service, it's available for diagnostic for essential medicine there, but you don't have the doctor, the nurse is not working. So it's affect for access to care at the level of community. So that's the three main challenge I can see. So how can we move forward? Of course, I say the government, okay, the top down, the funding for health insurance must be modernized, collaborate even with the private sector somehow for innovation to expand the scope for the catch with the new treatment, new diagnostics. And for service delivery, of course, we improve our primary health care at the level, whatever the health professional that they need to work, they have at the minimum the basic essential package to provide access to care for the people. And the last one, the very challenging, that's most of the countries, including Vietnam, I see. I was in the community 2 level, and I see how if they know the bonus or scholarship, continuous training somehow to motivate the people to stay where they're there, for to help their population very high. For example, just in Vietnam, about 9 or 10 doctors for over 10,000 population. Compare very low behind to Singapore, over 20 doctor for the same population. So that's struggling. How can we improve that for the people that have the program with the clean from the digital solution, how they can even in the essential community level, if they don't have the capacity to treat their patient, they have some kind of mechanism for them to clean them to the central level. So that's the challenge and how we can move forward. I can see, I can share. Thank you very much.
Thank you so much for the insightful input from Dr. Phiu Phiu and Dr. Mimi as well. And we can see that the challenge remains the financial constraint, the healthcare services, and also the digital line accessibility, the technology, and also the war, the conflict, climate change, and so on. So those are the challenges. And also there's some good solution that proposed by both of you, that also the collaboration and also sharing, learning from different countries. So we also see that the different application, the different practices. So that also lead to the second question that we'd like to also ask Ms. Theodora, that you can also share any best practices that from Singapore that you also can improve the health system for all. Thank you.
Thank you. Thank you for having me. Very happy to be also involved in this session. I was involved in an earlier session yesterday as well on jobs. So I'm clearly not a health expert, a healthcare expert. My role here perhaps is more to share the experience with policymaking, having been in Parliament, pushing for policy reforms and changes. But to answer your question, I think in terms of, I'm not in the best position to say what are the best practices to share from Singapore, but I can share as a Singaporean and as a Singaporean former parliamentarians. I would say that what we have done in the last, especially in the last 20 years, is to increasingly move from focusing on healthcare towards health, right? And so in other words, and I think Desmond Tutu was the one who used this parable, we can spend all our efforts trying to scoop the babies out of the river, but we should actually go upstream to see why are the babies in the river in the first place. So with the same concept, we've been talking about this for a while, and in the last couple of years, we finally launched in Singapore what we call Healthier SG. And that is really looking at population health in a way where each citizen would actually have a primary care provider that creates a health plan for them, right, individually. And that obviously is trying to, and we all understand why going upstream is actually better on the healthcare spend, right? Because actually it's more expensive to treat diseases than to prevent them. But it obviously means that if you go upstream in preventive healthcare, then you need all stakeholders and all parties and all hands on deck. So I wouldn't say we are definitely there yet. We've just really started getting the primary care providers to come on board, to want to do this work of providing health, if you will, consultation, right, health planning, no longer sort of just sort of, having a chat with you for 10 minutes and then prescribing drugs. So that's a real mindset shift. And I think that's important. And I think at this stage, I also want to introduce that in preventive health, we're still talking about the traditional health care that we're talking about, right? But there is no health without mental health. And in spite of Singapore being able to sort of move quite far ahead, having a world-class healthcare system, and now we're moving upstream to look into more a preventive population health strategy, we are still not there when it comes to mental health, right? And that's been the work that I've been really trying to do and push for, because you might have healthy bodies, but if you don't have healthy minds, then you don't have a healthy society. You don't have a healthy people. So I guess this is kind of just our experience in Singapore. I wouldn't want to say whether it's best practice or not. But even with mental health, we also should be going into preventive mental health, strategy. So what would we need to do as a country, whole of government, to prevent some of these policies that actually continue to exacerbate mental health challenges? For example, our education system is known to be a rigorous, onerous one. So that may not come under Ministry of Health, it's under Ministry of Education, but that's got impact on mental health, for example. So I think I'm seeing increasingly towards a whole of government approach when it comes to health, and it cannot just be the Ministry of Health looking at that. And that also means that healthcare spend and health spend needs to increase. So really changing the definition of healthcare to health.
Thank you so much, Ms. Andre, for sharing that good practices. And I think that Singapore is a kind of model for all our Asian country to learn and also to kind of follow to the model. And we can also see that Singapore is a country of having a truly decent healthcare system. Yeah, and it was.
Can I just add on? We still have challenges. Maybe we can say decent, but I think a decent healthcare system must always mean that it looks after everybody, especially the most vulnerable.
Yeah.
So we are still, working on that, right? Yeah. Just want to make sure.
Yeah, thank you for add on that. Yeah, and we also do agree that looking at the mental health is also another issue that is now become a kind of increasing, emerging issue, especially after COVID. Yeah, so hopefully later we can also have some more discussion about that. Yes, so that also lead to us to another areas that is about the workforce and also the technology. Yes, so as we know that there's a wide disparity in health workforce across the region. For example, the WHO data, so that Singapore have around over 20 physicians per 10,000 population, yes. While other developing in East Asia or in the Asian country have a fewer than 2. That is a big gap, yes. So this is also a question of the equitable to healthcare. So can you also share with us that what are the strategies that can be deployed to ensure the better distribute and strengthen the health workforce across Asian? And how can the technology help to reshape and transform the healthcare sector? So question to you, please.
Oh,
Continue.
okay, to me.
Yes, yeah, please. Yeah. Thank you.
I thought Chandra should be speaking first.
Still,
Still
yeah,
me,
Miss
still me.
Andre. Yeah.
Yeah, thank you for that. Thank you for that. I think we are all now, almost in agreement that technology and AI can ease shortages, right, and connect rural areas. And Dr. Piu Piu shared that with us earlier as well. But I just want to, I guess, say, just as I did yesterday at the job session, as much as we are leveraging AI and technology, which is obviously important, and we should. Um, we must also make sure that we maintain equity, right, and that these solutions are designed also with well-being in mind, because ultimately, we, as much as we think that technology and AI can help to close the gap, it can also widen the gap if there's no, I think Piu mentioned that, if there's no digital literacy, if there's no digital adoption, right, then that can actually even widen the gap further um, between the privileged and the vulnerable. So I would say that that's an important part to look into. I also think that it's important to bring up um, the need for leadership, right? It is. I see three leadership imperatives in trying to look into this shortage. In addition to using technology and AI, um, we should actually be also mobilizing the people. And I think both of you mentioned that. And I'll give an example. In Singapore, as much as you mentioned about, we are clearly, in terms of access to physicians, we are obviously almost, like you said, 20, to 100,000. Is it? Yeah, something like that. In mental health, it's not. So we've been struggling with mental health, right? And the way, because there's a huge shortage of mental health professionals, the treatment gap for mental health, well, in ASEAN, it's about 50 to 60% of people with mental health conditions do not have treatment. In Singapore, we still have as long as a 5 to 10-year gap of treatment gap. Treatment gap means the moment you have mental health challenges, by the time you see a doctor and get treated, right? So that's the gap. And that's because of accessibility and affordability of mental health as well in Singapore. And so what we have done is to actually mobilize the community. And that's why I'm saying that the leadership imperative is important. To mobilize the community, training community, caregivers, community volunteers, right? And then also looking at health support in different levels. So the first level of mental health support need not be a clinician. It can be someone who's well trained, and in mental health, it's called mental health first aid, very similar to the CPR concept. So I think community needs to be mobilized to support us in closing the gap, and that's a leadership decision. Then I think that whole part about telemedicine and AI, we need to make sure that leaders are responsible in creating some ethical framework around it. And then, of course, more importantly, I think we talked about the workforce. We got to be caring for the carers, the very people who are actually, caring for the system and keeping the system going. We need to take care of them. And if they're not well, they cannot treat well, they cannot heal well. And I think a robust health care system cannot be built on exhausted stuff. And so I think leaders must invest in their mental health and well-being. Um, so I think that's where I see us really pivoting more, having a systemic leadership conversation than sort of looking at it sort of piecemeal. Um, and and the one thing I want to say about healthcare workers is that why do we keep asking healthcare workers to be resilient, and we never ask why is the system that they're in burning them out? Right? I think then if we look at that, then we'll start to redesign the system quite differently. and to make sure that there's access, there's affordability, there's quality healthcare, but the people who are actually holding this system together and making it happen are also well themselves. Thank you.
That's wonderful. Thank you so much for the insightful response. Yes, so in summary, it could be like the mobilization of the community, the volunteer system, yeah, so that also contribute to the workforce of the primary health care and also the, a lot of the prevention, areas, and also the technology, the IT, but it's also the training, right? Yeah, how can they use, how can they utilize and assess as well? And also another one is about the leadership and how can we care for the worker who will also care for the people. So that is wonderful. Thank you. Yes, so that is the lead to the question, the next question that, we will also discuss about the One Health approach. Yeah, One Health approach. So in 2023, ASEAN established the ASEAN One Health Network to support the One Health approach, which integrate human, animal, environmental health. But what does it mean to us in practice, and why it matters, and also to what extent it has been truly implemented and integrated across ASEAN? So for this question, I would like to invite Dr. Wang Mi, Dr. Mimi, to share your thought, please.
Thank you. For the second topic, very important to One Health. Yeah, from approach declaration, how to make it become action. Now, what does it mean after, especially after COVID time? You see that One Health, how to make it integration efficiency from the human, animal, and environment health to really integrate systematically into the whole Thai region. That's very ambitious. But in each country, I see that the journey, the way, the declaration, the commitment is there. But for each nation, how can even each nation, because this we work for these three across sector. It's not only health. We say environment, health, animal, and human. So it's big. Even one sector, ministry of each sector, they work in silo. Now it's the raw sector. How can they make this integration? Not in silo. That means they must share the data, how to make it early warning surveillance system across all the sector to detect what is the greatest outbreak earlier. So it is for One Health to become really, truly reality. So each country, each nation, we need to work on the government, fragment, how can improve that for the each sector to work, to share data, to set up the system across the sector. And the second, again, we can serve it capacity, the team for each sector, how can they make this multi-minister for each sector to work really together to set up the system for the surveillance. I would say, okay, do you have to be capable to prepare for the next rest before it's coming? So that the system, the health workforce for the across sector to work together, this system, we need to be set up to align surveillance together across all the sector, very important. And of course, we say in this now with the technology, AI, we need to work with how engage successfully for the private sector from the manufacturer, food safety, risk, veterinarian. All these three pillars to work to make how to make the human, animal, and environment sector really work together. So we don't forget about how the inclusion engage this systematically for the private sector player in this kind of scope of work to make One Health really truly move now from declaration to action. We have the chance to build our health system. It's not only for more resilient, but more predictive, capable to catch whatever the next threat before it's become the next pandemic coming. Yeah, thank you.
Thank you so much, Dr. Wang Mi, for this insightful response. I'd like to also ask Professor Chandra to add any point on this question.
Yeah, thank you. I will begin with my three privileges. Number one, I do not know what is the reason of the organizing committee put me here in the central, because as you know, I'm the only man on the, on this one. So we'll see this is the importance for health, the importance of, usually we are talking about mother and child, now we are talking about empowerment of women, but this is clear women leadership in health. That's number one. Number two, I'm not only the only woman, but I'm the only group representing elderly, I'm sure here, because I just have my 70 years birthday last month. So, so you can clap hand, but she mentioned two times about vulnerable people. So this me. So, so what I'm trying to say is, women is important, but you have to take care of vulnerable because what she said. So that's important for health. My three privileges, the third privilege that I have is I'm the only Indonesian. Okay? So, welcome to all of you here. Hopefully you enjoy Indonesia. That's number one. And number two, because both of you talking about universal health coverage and then difficulty of urban and rural, we are not talking only about urban and rural. We have 17,500 islands. You may hear from other Indonesian, it's not 17,500. Maybe they will say 17,400. Or because for us, for Indonesia, miscalculation of 100 or 200 islands is not so much problem anyways. So that's, and the third issue related to the One Health, yeah, because we have so many. The third issue about One Health, because on 2023, when Indonesia hold the chairmanship of ASEAN, so here there is an ASEAN leader declaration on One Health implementation. Why is leader declaration? Because as mentioned, this is a cross-sectoral. If only Minister of Health, other minister will not listen. So we go up to the president, to the king, to the prime minister. So they already signed something. Of course, signing something in that level, going to the village is different story. At least there are 5 points on that declaration. I can see one half has been done. So number one, establishment of One Health Network. It's already been done. 2023 endorsed. 2024, as far as I know, the first meeting in Indonesia, and there's some activities. And maybe 2 or 3 months ago, there's another meeting in Malaysia because Malaysia now hold the chairmanship. So something already that's number one. Number two, that ASEAN leader declaration requests to make a One Health ASEAN joint plan of action. So I just checked yesterday. So there is already was ASEAN One Health joint plan of action 2023, 2024. Now it's already 2025. So there is process now for ASEAN One Health joint plan of action for 2025, 2030. So it's only half of that one. Right. The other three is not yet being done. It's 20 minutes left, he said. But anyway, the other three is related with implementation. So what my suggestion is, because it's only 20 minutes left, let's have some recommendation or something. One Health is already there, declaration already there, even by the president, prime minister. Let's do something on the field. That's important. Thank you.
Thank you so much for the additional from Professor Chandra. And yeah, it is very important that the One Health approach and how it's connect the human, animal, and also environmental health. So we need to work together, not just a health sector, but also agriculture and other climate change sector should be together. Yes, so this perspective lead to us to think about the future pandemic. Yeah, how can we be ready and be well prepared? So the COVID-19 crisis have shown us how quickly the health threat can spread across the border and how essential it is for ASEAN to be ready for the future health emergency. Yes, so this one I would like to also ask Dr. Fiu that, yeah, can you also share with us that, yeah, so if we have faced another pandemic in the future, how ready we are as a region and what lesson we have learned and what more need to be done to strengthen our preparedness. Over to you, please.
Thank you. We have 20 minutes, so I will be also very, very quick. Have any of you experienced one of the friend or relatives lost during pandemic? Me, actually, or someone you know passed away during COVID-19 pandemic? Actually, majority of the people know someone passed away during the pandemic, but we Homo sapiens are very, very forgetful. And now that we think it is long far past. So before the pandemic, COVID-19 itself, epidemiologists like us always warned the policymaker that a pandemic is coming. We don't know when it will come. But we are shocked to witness that our health systems were not prepared enough. Almost all health system took it by shock. For example, Hong Kong's health system, one of the best, but it's nearly collapsed when the time comes. Indian health system, almost everyone, they didn't prepare well. So it didn't. So what can we learn? It's a very good question. So I hope we learn something. The one thing we should learn is that how well we should make trade-offs. So trade-offs by what I mean is that when we do lockdown, we are actually trading off between human lives and economic loss. Which one is more valuable for you, for your country? Would you rather prevent human lives over economic loss than you will have strict interventions, right? So you better be prepared for better value frameworks, and you should be very good at trade-offs. Everybody is making trade-offs every day. So I'm not talking about technology. I'm not talking about any epidemiological niche areas. I'm just talking about what values as a country you have to fight another pandemic, which I can reassure you that it will come when it comes, because it is kind of nature. There are waves. You know, we keep studying about infectious diseases. It is coming, going. So what is your value? That's the best preparation that you can make.
Yeah. Thank you so much, Dr. Fiu Fiu. And I'd like to ask Professor Chandra to add any point. Thank you.
As I mentioned, I'm the elderly people here. So I have experience. I became a review committee of the pandemic H1N1, 2009. So that time, as you know, under the international health regulation, WHO has to establish a review committee after every pandemic. So I was the member of 2009 review committee, and my committee come to the conclusion that the world was ill prepared for H1N1 pandemic. Then people trying to prepare better. That is 2011 recommendation. People trying to prepare better. And then 2010, there is another pandemic. Okay? And even bigger than the first one. And there's another review committee. And that review committee come to the conclusion that the world was not prepared. So it was ill prepared, was not prepared. And then if there is another pandemic, and who will be the review committee? And there will be another English terminology of that one. So we are not prepared. We are not learning from our lesson. That's number one. Number two, because we are talking about ASEAN, it's already, 70 years, need to read something. Okay, yeah. So here in ASEAN, we have ACFID, ASEAN Center for Public Health Emergency and Emerging Diseases. I'm helping also the Ministry of, while preparing this one. And there is already 3 activities. One in Vietnam for prevention and preparedness, one in Indonesia for detection and surveillance, and one in Thailand for response and risk assessment, something like that. But yeah, hopefully this is running very well, because I know this is already 1 and 2 years and looks like it's not running quite well. So at least something happening. So hopefully this can, link our region to become one. Why I said to become one? Because what should I say in English? Yeah? Because I see African CDC. When Mpox hit them, there is in ISR before pandemic, not before pandemic, there is terminology called public health emergency of international concern. That is documented in ISR. So if something happened, the DG of WHO will declare public health emergency of international concern by WHO. It's only African CDC who declare public health emergency of continental concern. So they declare that one, Mpox, as public health emergency of continental concern before WHO even declare Mpox as public health of international concern. And when the DG of WHO said, okay, Mpox is no longer public health emergency of international concern, the African CDC said, no, it's still public health emergency of continental concern. Wow. So I do hope that here, we in ASEAN, we can do something like that. Of course, we don't want to we got something big hand, but if we work together, whether through this ACFID or other something, but we better link together to prepare for the next pandemic. Thank you.
Thank you so much for the insightful response from both Dr. Fifi and also Dr. Chandra. Yeah, so this is to be better prepared. We need to learn from our experience and also to build a stronger health system and network and early action, as you mentioned, early declaration even, yeah, and also collaboration across the country, across the region, the continent. Yeah, thank you so much for that. So now I think there's a few more minutes for the open question from the discussion. I think we can pick up a couple of the discussion. So who wants to go first? Yeah, so I think that's for discussion, but I'm sorry that we may need to pick two. So lady first, I would like to invite maybe from you first. Yeah, you first, and then we have another. Yeah.
Hello, thank you so much for the insights. I'm Macy. I'm from the Philippines, and I lead a youth-led nonprofit in Manila. And we advocate for PWDs. And I just really want to ask a specific question because something I've been experiencing. And our organization is youth-led, so most of us are from the ages of 15 to 25. I'm 23 years old. And since founding the organization, something that I encounter a lot is a lot of parents emailing us about their children's mental health concerns. So on an average, I would get like 50 emails from parents in the Philippines asking for help. Like, I have a son with autism, like, where should I go? Like, who should I reach out to? What's like a cheap place to get therapy or to consult with a psychiatrist, because our system is really shit. Yeah. And like for me, it's really difficult because I started this organization at 16, and so I lead like so many young people who get these emails, and they ask me, what do we reply to these parents? Because these parents are like 40 to 60 years old, and some of our members are also mentally ill. They go through their own challenges, and we want to keep continuing to help the parents, but it's so difficult. So I mean, I would really appreciate any insight because all of you have amazing experiences, and I think it's something that we're really struggling with because we also want to make use well of our language, and some of us are psychiatrists, some of us are psychologists, but not everyone is. So how can the youth help these parents?
Thank you for the question. Maybe we got one more, and then the panel can answer. So one more from you, please, to be gender balanced.
Hello. Yeah. Hi, my name is Goraket. I'm from Laos, and I'm from a community-based mental health organization focusing on prevention and promotion of mental health among youth and working professionals. So a little bit before I ask the questions, Laos, we only have one psychiatrist and one clinical psychologist among 7 million population. So workforce, as you all mentioned, always will all continues to be like scarce. My question is, as she said, like youth-led is important, but we will work with the MP to create a crisis hotline for mental health. But we want to consult with different sector like providers, capacity building sector, and of course the youth, as they are the next generation who will be run this system. So my question is, how do we make it simple? Because all you say like different community make different meeting and all that. How do we make a simple focal point and collaborate and co-create between provider, youth, policymaker? Like how do we co-create it to make this simple, integral, like maybe application or hotline, like make it work? Yeah, very specific. Yeah.
Thank you for the question. Before the panelists can address these two questions, I just want to check that whether we can take other question from other discussion or still. Okay. So we'll go ahead. We have two more, right? Yeah, two more discussions. So from you, please. From Linh, please.
Yes, so hi everyone. I'm Linh. I'm work on health too in Vietnam, Cambodia, and Laos. So I think the issue is the same previous question, but I want to elaborate more about a kind of region actions on this mental health problem. So you can see that Philippines has problems, Laos has problem, and I think that all ASEAN have problem about mental health. Like the rate is about increase 80% from like 20 years ago or something. Yeah. So and when you mention mental health in ASEAN country, it's kind of like luxury terms. Like parents told their children that you are your kind of if you are vulnerable communities, you cannot access to the mental health facilities. So the question, it's not really a question, but I want to raise a discussion here is as how we can, as one ASEAN country, can how we can integrate the mental health into education system, into community health system, and then how even like people never like they delete the thought is that mental health is only for like kind of like well people like now even the people vulnerable in remote areas they still can face mental health problem about the climate change or something. Yeah, so that is an issue that I want to mention here.
I'm sure that there's two more discussion. So just be quick, please. Yes. So each of you. Yeah. Thank you.
Hi, I just want to say thank you for the very interesting talk. And for my background, I am here representing Brunei under MAID training as a first aid trainer. And at the moment, I'm also doing my PhD in nursing. So I would like to agree with everyone's statements earlier. We really need to start from the bottom, and we really need a collaboration between all the industries. Because in Brunei, we're very fortunate that we have almost essentially free healthcare, but the issue is that not everyone can access it because of things like transport. We rely heavily on cars, so we don't have a good public transport. So people who are poorer, who cannot afford cars, even though the healthcare is free, they still cannot access it. So I think those are some really important things that we also need to think about. Yeah, and in addition to that, also my research is also around mental health. So I'm really grateful that most people are talking more about mental health. And a really big issue that we also face in Brunei is the stigma, and I think that's very prevalent in all ASEAN countries. So yeah, I think that's just my comment. Thank you.
Thank you.
Yeah. So final question. Yeah. Yeah. Final. Yeah. That's it.
Okay, hello, my name is Amin, I'm from Indonesia, and my background is biomedical engineer, and now I'm working in Ministry of Health as procurement officer. So my question is about the adoption of technology in terms of fixing the healthcare problem. Because I see it in the first hand, as a country, we bought a technology from other nations, like very advanced. When we implement in our country, there's a mismatch between what we actually need and what we buy. And even though that the technology works in some countries, but in Indonesia maybe it doesn't work 100%. So how come that our needs really served by the advancement of technology of healthcare? Thank you.
Thank you.
Thank you so much. So now over to the panelists, starting with Mr. Ted.
Thank you. Thank you. I'm so pleased that you raised so many questions on mental health. It was also why I actually suggested to the organizing team that we need to actually address mental health, even on a topic on its own. First of all, thank you for wearing the kafir, for the support. Yay. So I hear you all. I actually got onto this work of mental health because I had my own personal brush with depression almost 20 years ago now. So stepping up in Parliament, doing this work for the last 20 years, is not because, it's something that I do because it's actually who I am, right? What I've actually gone through, come out of it, having the support system, knowing how deep and dark I could get to. And this is with someone who used to be, when I had the fall, I was actually a CEO, so I had the resources and all that. And so what more those who don't have access to resources to be able to support themselves? It was only last year that in Singapore we have a national mental health and well-being strategy. So there is so much awareness we need to raise as a region across the world, because even in Singapore it took so long, right, for us to actually be able to sort of pull together a national strategy in mental health. Until you have that, you don't coordinate all the, it's not just the ministries, it's actually all the stakeholders in the community as well. Mental health is complex, right? To think that it's all just under health, it's really, or Ministry of Health, it's actually not, not going to help solve this issue. just addressing some of this directly, right, for what you are going through. And thank you for doing this and setting this up. I do think that it's competency. We focus so much on literacy and numeracy in school, but we don't talk about mental health competency or literacy. It took many speeches in Parliament for mental health education to now be compulsory in Singapore in all schools. Right, and that's only just started 2 years ago. So I would say that focus on competency for all community members, but also all family members. So mental health first aid, peer support training, all right, to break mental health support into different phases, especially for in Laos. I know the Laos number because I was quite shocked to see that there's only one for the entire country. I think then it's so important that you have to mobilize the community. You can do mental health first aid training and peer support, and that would get you to support quite a large number of the population who are struggling, right? Mental health is a continuum, right? Not everyone who has a mental health challenge means they're in crisis and they need clinical help, right? You can be flourishing with an underlying mental health condition because you are well supported in recovery and treatment. You can be languishing with no mental health condition, right? So make sure that we understand this continuum of being in crisis all the way to thriving and everything in between, and then organize your population and community accordingly so that you're not choking the very few psychiatrists or psychologists that you have, but you kind of, start training a much wider pool of the population to support you. But thank you all for sharing this. It's really been, and please talk to your parliamentarians to raise this in Parliament, because until I was in Parliament, in fact, when I was in Parliament, I was called weird and troublemaker because I raised mental health every single speech, and this is before COVID. COVID has made the mental health conversation a lot easier. But stigma is real. Our Asian culture just doesn't want things to be put out in the open. So we need to then find ways to talk about this no matter what. Thank you.
Thank you so much for the response. I think for the interest of timing, I just ask one panelist to ask a quick response, especially the technology question. Anyone? Yeah.
Okay, 2 minutes. Okay, very quickly. I come back to the idea one. The topic second, we say One Health Declaration, and in is Mr. Here, he said that I would like to add more. Look like just Thailand, Vietnam, or Indonesia, we have the national action plan in place. They start at least something. That's just, it's not the whole reason, but they start already. So all that mental health just one the subject in the whole in One Health for the reason to move forward and to work with on industry or the sector how to make the system. And the most important that's even they align the surveillance system in play, a capacity there, workforce allocation, they got to training there. But the important that's the financing, how to be earmarked as a national action plan implementation rather than just the donate process short term. That's one of my big comment I would like to share. And technology event, of course, and we thought it does we call that telehealth, telemedicine. Each level, each country they have the plan from the MOI. Each country I believe even in Vietnam they have the policy to clearly to give the order for the health system to be adapted to be each level of care. How can to adopt for the digital solution for. For example, it's essential the annual checkup. They don't need to go travel the whole day from the rural area, move to the big city to get that very minimum package of checkup. For example, so telehealth, telemedicine can support, and all the solution technology from provider is already in the market. But again, so how can that develop from the private sector? How can engage them systematically in the One Health umbrella? We can move forward. That's my comment to share. Thank you.
Thank you so much. We are out of time, so thank you for all the engagement and also the insight from the panelists. And I think that this session is a send a message to us that we need to work together as One Health and ready, prepare for the future pandemic whenever it happens, and also the coverage for the healthcare services that we need a lot of efforts together, and especially we care for the most vulnerable children and people, the disabled, the women, the ethnic people all together. And also we need to work more than health sector. Yes, and the elderly, yeah. And more than health sector is working with different cross-functional sector as well, especially in the context of climate change. Thank you so much again for everyone engagement in this session. Yeah, so over to Secretary, please.
Thank you very much. Yes, okay. Thank you very much to our panelists for such an insightful discussions. Once again, everyone, let's give a big round of applause. Hello? Okay. Before closing this session, we invite the panelists to remain on stage for a group photo. As a token of appreciation, Dr. Nino Patijalan and FPCI will also present souvenirs to speakers. Yes, please, Rafiko.